Here with you.
You don't need an introduction. I'm tasked to give you an introduction. So, Dr. Gonzalez is a medical anthropologist in Guatemala, and she has completed her PhD in University of Zurich, and she is an international scholar focusing on One Health and public health, especially on the interaction between the indigenous Maya medicine with the modern biomedicine. Very interesting. We're looking forward to your keynote talk.
Thank you so much, and thank you everyone for having me here. I'm gonna have my phone so I don't lose track of time. Do you have the little thingy for pressing? Perfect. Thank you so much. I'm gonna need it. I have a bad reputation for putting too much movement on my PowerPoints, but it's to keep it a little bit more interesting. So I want to share with you, because we are given 10 wonderful minutes, I have to choose carefully what to share. And I wanted to more than give you a lot of data about the research that we've been doing with our team in Guatemala, which is comprised of a very big international team, which many of you here have contributed to as either uh, our supervisors, my PhD supervisor, Peter, and colleagues, mentors. So it is really what you're going to see is a bit of a story about how to make research meaningful. So sharing some insights on what I call intercultural transdisciplinarity. Uh, so this is what I ask myself every morning when I wake up, and I have a very young team back in Guatemala of impatient optimists. And I ask, how do we make our research relevant, guys? Because we were for a while very infatuated with postmodernism, but it's really useless in Latin America because we really need action guided research for societal transformations. We have tons of problems. And so, how do we transform the knowledge, fill in the blank, everything you do, but since we're at the Daylight Academy, on Daylight, into positive societal change? And the first thing I have to ask as an anthropologist is relevant from whose perspective? Of course, we live in this world where our point of view as scientists makes a paper very relevant if we want to get further funding. And we need to share and communicate findings to policymakers, in my case, the Ministry of Health. But I work with indigenous communities who, far from an idealized context or a romanticized context, live in very harsh conditions under the poverty line. Well, half our population is under the poverty line. And healthcare is kind of like this unknown concept as the Western world would understand it. But yet it coexists with this really rich epistemology on how to live happily and healthy in the environment you are given. And when I ask relevant from whose perspective, I wonder to the Ahqiqa Omanel people I work with, what is important to them from spending by now 15 years doing research with us? They call us the white people, even though I'm a little brown, but you know, everything is relative. And they say, well, what do you want to get out of it? Well, what do you want to get out of it? And this conversation can go on for a long time, but it's a very important part of the conversation. And I want to share um, this learning curve we had over one project of many we've had with Swiss universities. So when I was studying at the ETH, I was very lucky to have a board, a PhD board comprised of 7 really good scientists, because the project was so crazy, we need 7 disciplines. And I met Dr. Jakob Sinstag from the Swiss Tropen Institute, and we ended up doing later a postdoc on zoonotic disease, so disease transmitted from animals to humans. And I was more or less introduced to the One Health approach from the Western mentality of what that is. And the goal was to understand the load of leptospirosis and brucellosis in a population that was decimated, apparently, by this disease, but no data. Government doesn't surveil this disease, doesn't have protocols for treating it. And we were suspecting it was pretty bad. So, of course, One Health approach seemed perfect because it is an integrated approach where you have to prove the benefit of interlocking disciplines. So it's not about only the epidemiologists looking at leptospirosis in children and adults. or veterinary doctors separately looking at all the mammals in the towns, but it was about combining the knowledge and how do we make it cheaper to surveil this disease? Is it easier to or less expensive to surveil cows for brucellosis? Before the the spread of the disease is so much that it gets transferred to all the human population. Is it cheaper to vaccinate animals rather than then face the public healthcare constraints of having to treat a lot of humans? So this is a One Health question. And of course, we did it by the book because it was the first time we were doing this, and we did have a cross-sectional study to estimate the prevalence of these diseases. And of course, we had to surveil human populations and all the mammals that we could come up with in these areas, and also the ecological setting where we realized land use change from a subtropical healthy forest towards basically cattle farm, cutting all of the forest for cattle was going to have an impact in brucellosis spread, which usually we get it from contaminated milk, in the bacteria in the milk of the cow, and we drink it without boiling or anything, which is very common in Guatemala. And of course, so it all worked out, and we could then establish a syndromic surveillance project where we basically worked with medicine men and women and people who speak no Spanish to surveil all of the risk symptoms for these diseases in animals and humans. And we created an application where just with drawings, people back in Guatemala had frijolitos, little beans, so not smartphones like this, but the tiny little black things that don't have that are not smartphones. So with SMS, with the midwives and everyone, we created this clever system. And we thought we were so clever because this worked, right? But it didn't work. It didn't work the first time, didn't work the second time until we actually had amazing workshops with the communities of different ages, different age groups. First, we were only talking to men, and then, of course, we realized that they're not the home caretakers. They don't take the kids to the health post. They don't even know what's going on with the animals because the women take care of them. So slowly, by working with the community, this system became more efficient. And of course, the town didn't care about surveilling disease. They care about what are you going to do once you find leptospirosis in my children? What's the healthcare treatment I get? So we had to create the response mechanisms with small clinics around. And yeah, we were able to estimate that 5% of the population has leptospirosis. It's pretty bad from a healthcare perspective. And brucellosis was a little less, probably because dairy products are not so popular in Guatemala in that area. But the point is that we were missing out on the real potential because we were not having enough conversations with the stakeholders. So we started to do more of these community gatherings under the big trees and discuss, okay, how do I surveil temperature? Fiebre, calentura, temperatura. Okay, in Spanish they seem similar, but in Maya Chi languages, there are 12 categories for fever. Cold fever, hot fever, fever of the feet, fever in your stomach, fever. I mean, it's like, what fever do you want to surveil, guys? And the epidemiologists were like, 38 degrees or higher. I was like, yeah, but that doesn't exist in Quechua, so choose. And having these conversations with the local community really made the surveillance system sensitive. And then the magic happened. Then the elders started to exchange with the epidemiologists and the veterinary doctors and all the people we had in our team, and magic happened. So I say we made it to the sun. It shined on all of us. But what does daylight have to do in all of this story? So by having these workshops, we were able to um, not only impose our epistemology on what surveillance should be, what healing should be, how do we treat infectious disease, how we disinfect surfaces if there's no doctors here, no public health care, what do we have locally that we can use? And so from these conversations, these are all midwives from one little town that traveled for days just to meet us for a week workshop. And so having these participatory approaches really got us to understanding the Maya concept that everything is interconnected. And maybe you've heard some other presentations I've given before about this. I'm not going to repeat it. But in the Maya cosmogony, the human is only one little chain, part of a huge chain of interconnectedness with our older brothers and sisters, animal and plants, who were here before us, and the elements on Earth, and the sun, and everything else. And while we were struggling to work with the Ministry of Health in trying to get the Ministry of Human Health and the Ministry of Animal Health to share data, to try to understand the One Health concept, the One Health concept was already intrinsic in Maya medicine. And we were using una salud. Hey, una salud, One Health. They didn't get it. But when we had these conversations, we understood they already had a concept called Kawilal, Jun Kawilal. Kawilal is One Health. And it is this complex, apparently, but very simple way to explain that the health of Mother Earth, called Kawilal Tzultaka, and the health of animals, Kawilal Kishul, and the health of all humans in community, Kawilal Nikomon, is really one. And they were able to teach us how these things are interconnected, right? So when we were out gathering medicinal plants to register the treatments they were using for all of these chronic and infectious disease, of course, we were working with the elders, and we could see that for them, a forest has an identity, and they had lots of indicators to say whether the Kawilal Tzultaka is a healthy one or a really bad one, and how we humans have transformed this, and how our food systems are produced. If we use too many chemicals, they have a word for this. Itzalabal. It means basically dying. Like we're putting death in our food when we use toxic things to. They consider a lot of chemicals toxic. And so organic farming is considered healthier, and we know that from our own research. But the point is that there's concepts for these, but they were collecting things in the forest to bringing the seeds closer to home, planting, how we produce our food, and then how does that relate to the health of the community, as in one cycle, and the health of individual families in this one concept. So if a family doesn't have enough corn for one summer, another family will lend it. They will borrow. But everyone has to have some food, and everyone needs to have some fruit, and everyone needs. So have you seen how bananas grow in the subtropical forest? I mean, you can bring one of these massive things called pencas, but you won't be able to eat it all yourself. You have to share. That's the beauty about tropical fruits. It's we can't eat one papaya because they're this size. You have to share with your neighbors. So sharing is part of the culture. And so the concept that communities and humans are healthy by sharing, it's part of the culture. But then you begin to see the really interesting thing with zoonotic disease. And we saw, they would explain that, of course, that's one of our dog from our neighbors carrying a monkey he befriended in the jungle. And we know about transmission of diseases from wildlife to domestic. And they knew, they had names for what diseases jump from one animal to another, but we were not tracking that at the beginning. We learned from them. We asked better questions for our research because of listening to this Kawilal concept. And they very clearly said, look, our kids have more bites from vampires. Why? Oh, because we're destroying the forest. Well, not us, but the company putting palm oil over there. So there are no middle mammals anymore. So the poor bats, and that's how they say, the poor bats no longer have food. So they have to come and drink from our animals or from our children at night. So imagine coronavirus in bats is huge, many strains in Guatemala. Like what's breeding there? They knew that the transmission of diseases is directly correlated to what we do with the environment. And so they said, well, Mother Earth has water, but we are contaminating it, and our fish are now sick. We can't eat them, or we get sick ourselves. But also, we are contaminating or healing the soil. And so, all elements are identified with indicators as part of measuring Kawilal Tzultaka. And here comes the interesting part. They did have the sun in here, whereas our own Western epistemology doesn't have sunlight in the One Health concept. I mean, at least not that I've ever seen it. And so to me, this was like, guys, you're thinking of everything. So explain to me how sun brings health. Oh, so well, it's obvious. It brings the health of everything. So you know how seeds are stored. Before you plant them, you have to put them in under the sun, and probably kill some fungi or something that you were, while you were keeping them stored in your home, but also elderly people are supposed to go outside carried by their families, even when they can't walk early in the morning to get that sun and late at night. And they correlate the built environment to how poor our access to sun is. So they say poor people in the city, those guys in nursing homes, in these little rooms all day, they're going to die so fast because they don't get the sun. And Father Sun gives us all our health. And there are words and terms that I would like to explore about what this really means. So roughly, you would say, okay, Monica, but what good does these do? And of course, from the perspective of how do I make these research relevant, it helped us do better surveillance system, better data on active surveillance at homes by involving local knowledge carriers. But the interesting thing was, after we were done showing to the Ministry of Health and all the people in these communities that they were surrounded by zoonotic disease, they said, okay, now what? You're not going to leave us like this. What are we going to do with it? So the midwives came up with an idea to train other communities to understand their risk assessment. We want to know how much our communities are in risk of contracting zoonotic disease. And so by working together, we came up with this community guide called Kawilal. And it has 32 indicators that explain very easily to people with just very basic education levels, usually the school teachers in the town, how to use very simple tools to study 32 elements to assess risk of zoonotic disease. And this is a community-based surveillance. But the interesting thing is that we not only have here like density in the homes or population density, we have indicators like Kawilal Sultaka, and they measure it by community consensus. And sunlight is in here, is one of the indicators. So for them, a healthy life that prevents the spread of infectious disease includes the health of Mother Earth, of being exposed to sunlight, and so on. So that was a practical way of making our research relevant for them. So maybe nowhere else, right? But that's why I asked the question. And we've been talking a lot about transdisciplinarity. So I would ask, what does it take to build good partnerships? And these are pictures from many projects we've had in Guatemala over the years. Maybe some of you can see yourselves in the picture in the jungle, Heinrich. And the thing is, it takes a lot of cultural humility and understanding that we can all get what we want from this research. So diverse teams require multiple disciplines, but the hardest thing is having partnerships at equal footing. So when we do collaborative transdisciplinary research, we say, oh, it's joint problem definition, joint problem representation, joint methodology implementation, joint data analysis, and joint everything, but it's a bit of lip service because it's hard to do. When we've done it, it's really expensive, and most funding bodies will not give you money for a true transdisciplinary process because it takes a lot of effort. For us, it meant on-site translation of 4 languages at a time: English, Spanish, Cachiquel, and Tuhil, so we could really have equal footing. But the point is, like, this is the usual way we organize a research project in Guatemala with Swiss partners. Academia, government, community, and industry working together, and we create a steering committee with 2 people each, except industry. We only gave them 1 seat because they have a lot more economic power usually, but we can negotiate that on a project-to-project basis. So what this means is that we foster an ecology of knowledge systems, but with these come clashing interests. So I ask, how do we make our research relevant? From the perspective of whom? In the surveillance project, the Tigo company that gave us all of the SMS system for free was not just being generous. They wanted a cool picture and say they are a cool company helping in the Petén because they just were involved in a very nasty piece of news about doing something very bad in our country. So they wanted to, kind of clean their consciousness. Fine, I'll take their SMS messages as long as they serve the communities and they serve our research. And the communities couldn't care less about our publications on new protocols for leptospirosis or One Health and Kawilal. They just wanted access to healthcare. And so the point of transdisciplinary research, I guess, and this is the message I'll leave you with, is that any time that I've seen myself asking the question of how do I have societal impact? In this case, One Health. Um, Definitely, all of you have been showing us robust research. I'm always impressed with everything that is shown in this Daylight Academy. So we have to stick to our really rigorous state-of-the-art disciplinary research, but we are now working on interdisciplinary research. So I love working with biologists and chronobiologists and veterinary doctors and people who can bring a new angle that I hadn't seen before. And the point is then that we cannot forget about transformative knowledge. So if we have scientifically robust protocols, but not socially robust, we cannot reach consensus. So for me, the invitation is to think about how do we design projects where we have partnerships with the real world, and we might not understand these guys, but we just can build a consensus about how to collaborate together. What can they use from our research? We don't need to drive the impact. They can drive it, and we can empower them to do so. So I have these really good colleagues in the Ministry of Health, but I don't do their job, they do their job. I just give them the data in an accessible way. I make them little videos. I don't give them the paper in English. And we make all of these accessible for them to go back to their bosses and push the envelope in the Ministry of Health. And when they need us to play the part of the scientist, then I go and I do a presentation for the minister. But the point is that by having this consensus potential, by inviting to the table people who are very different from us, I think that's what's driving research. So I've been hearing all of you talk about how do we make more regulations on building and how do we bring more knowledge of the chronobiology cycles to public healthcare. And I think it's by having teams that truly go out of academia from interdisciplinary research and cross into the transcendence of disciplines to incorporate policymakers in from the start. We do it from joint problem framing. It takes longer, but it gives it a very interesting angle. So I won't have time to share the other slides, but if anyone is interested, we're doing this project on the Mesoamerican Institute of Ethnomedicine to test all of these ideas once more, and you're all invited. ETH is already working with us, and many of you are. And the last message I want to say is that I'm not going to be able to explain this example to you, but basically I was just going to show that in our research, one plant, one begonia, is used for treating human, animals, and disinfecting the soil. And then they ask, how do we reproduce this plant in a different environment because it's disappearing? Can we bring it closer to home? What do we need to change? What are the light conditions in the forest that are changing? And the thing they told me is, we live in systems. And the question is, so can we work in research systems for greater impact? We have disciplines, but can we connect them meaningfully and have a conversation with other disciplinary cultures and other epistemologies so that perhaps daylight can be a boundary object, place of common interest between all of us who are so different. And I see us creating projects in the future that give each one of you a cool paper, but that give my country a step closer to accessing universal healthcare through our own medicinal plants. And with that, I leave it like that as an invitation. So thank you.
Thank you so much for your inspiring talk. We have time for one long or two short questions. Please.
And thank you so much for that. I just had a general question. I love seeing the kind of indigenous, like cosmovision, as they would refer, what I'm familiar with in Mexico, with the One Health approach. But I wonder, how do you navigate,
Cut off
like,
exactly
it's
start on time.
like really sensitive traditional ecological knowledge and taking, like, framing that and kind of in this like parallel alignment with like very colonial structures like the One Health approach, and how do um, the people that you work with feel about that as like as rights holders, as knowledge holders, and yeah, how do you navigate that space? It seems really sensitive.
No, thanks for the question. It's very tricky, and some of you may know this, but I'm going to be very honest. It's hard to do this research at equal footing. I live in a very racist country. It's colonial in nature. So academics are mighty professors who come to these little towns. And ethically, it's questionable how we've conducted research in the past, which is why I love transdisciplinarity, because it forces us to share our budget, to share our goals, and to incorporate from the start this discussion. And the hardest discussion we had at ETH, I don't know if Peter remembers, was how are we protecting traditional knowledge on cancer, which they had never given to anyone before. It had been kept secret. But I was trained as a Maya Achik for 7 years, and they tested me to no end to see if I was worthy of being a bridge person. And each one of my colleagues from Switzerland that has come, or Michael from UCL that has come, they get tested too. You had to go to a ceremony. And a lot went on in those ceremonies. They kind of scan you up and down spiritually. It's like, are you worthy of receiving this knowledge? And it's very beautiful because there's a community consensus. Once you are given by extension, because I earned their trust, to another researcher, you have to keep that trust going. And so the first time they gave us knowledge on cancer, it's protected in ETH under lock and key, and only the elders have it. And they never let me publish 80% of what we research. What I publish is 20% because they just won't let me tell people about some plants. That's it. And it's not time, they say, and we have to respect that. So we've tried intellectual property. It's registered to the name of this community council. And the hardest thing as a scientist is to sit on this data and do nothing, right? But it's part of the respectful negotiation. And everything will be published. It'll come a time when they will allow it. But I guess that being patient in that sense is how we earn mutual trust. But yeah, we almost got into a huge fight on intellectual property and the Nagoya Protocol and access and benefit sharing, but it worked out in the end.
Thank you so much, Monica. I know there are many questions and people want to interact, but I have to make sure that you guys make to your trains and planes, and therefore I will do the hard job and pausing. Please join me thanking Dr. Monica.